Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode of the Keeping Ashland Healthy podcast. This is David Ross with the Mental Health and Recovery Board. And on today's episode, I wanted to put a spotlight on what's called Overdose Awareness Day. Overdose Awareness Day on August 31st. Now, I wanted to talk a little bit about nationally what's going on, as well as the state, and then maybe most importantly, what we're doing at Ashland County to address the overdose issue, particularly overdose deaths in the county that we've tried to focus really hard on to bring down to zero, which is always our goal. So let me start by saying it's a relatively new initiative in the state of Ohio. The governor a few years ago designated August 31st as the first Overdose Awareness Day. So it's taken a couple years to ramp up local efforts in all 88 counties to really, spotlight this issue, talk about the resources that are available to communities to both educate and raise awareness, but also to talk about some of the interventions that different communities are involved with. So let me start by saying nationally, the numbers, in 2023, which is the last complete year of overdose deaths that we had reported, were still over 100,000 at 105,000. The provisional report, though, that we received back in December, so this would be December of 2024, we were estimating at that time, based on the data, it was 80,400. So it is provisional data, but it still seems to indicate quite a decrease, a welcome decrease in the overdose deaths. It takes a little while to make sure that that 80,000 number is the right number. But that was the provisional data from 2024. But we're still waiting for that to be confirmed. But if that is, then that would be a welcome decrease. But again, 80,000 folks is still far too many that are dying due to overdoses. And just by reference, we lose about 50,000 people each year to suicide. So still much more than even deaths due to suicide. Now, how does that compare with Ohio? So in Ohio, in 2023, again, the last most complete data that we're confident in, we lost over 4,400 folks to overdose death in Ohio. That provisional report for Ohio that would end in 2024, again, mirroring the national trend, we see a slight reduction down to 3,600 is what the provisional report was saying in Ohio. And I will say that same trend has been mirrored in Ashland. And I feel more confident in the Ashland number since I'm directly involved as part of what they call a suicide and overdose fatality review committee, which is headed up by the health department and includes law enforcement agencies like the board and other agencies that are working with folks in the community. So we had 14 overdose deaths back in 2023 and then 7. And that data in 2024, that's not provisional. That's a good number. So we saw a 50% reduction from 23 to 24 locally. So that is very good news. But I did want to talk a little bit about efforts to address overdose. And again, some of these things, hopefully, audience, you have seen these around town. You've heard us on previous podcasts mention it or seen some of our social media posts. But probably the easiest thing that you can do is to have Narcan, to have naloxone, which is almost, I'm dating myself, but Dristan, some of the old nasal sprays that folks used to use to clear their nasal passages, the version of Narcan or naloxone that we make available to community members is that form. It's not a needle. It's not an injection. We wanted to take some of the anxiety out of administering the Narcan or the naloxone. So it's the nasal spray. So essentially you stick it in the nose, you hit the plunger, and that's all you need to do. Now, you may need to administer more than one dose of that Narcan. The other thing that our medical professionals tell us is that you need not be concerned that if you administer the Narcan and it wasn't overdose due to opioids, it's not going to cause harm if it was another substance. So don't worry about that. And I can tell you the Narcan is being widely distributed, not only in our county, but throughout the country. I know just in Ohio itself, there was over 297,000 kits distributed in 2023. We've got well over 100,000 folks trained on how to use Narcan. And we are looking at well over 25,000 at this point overdoses that we know were reversed because of the use of Narcan. So when you hear us talking about Narcan saving lives, it really does do that. Not to get too sciencey on you, but basically the Narcan knocks off the opioids that are binding to the opioid receptor sites, which are causing the issues for the person in terms of respiratory issues, breathing issues. It temporarily knocks those off, and the person is revived. Again, I will warn you that when folks are revived, they're oftentimes experiencing withdrawal. So they're not particularly happy at that moment. But regardless, I think using the Narcan, it truly does save lives. So in addition to the Narcan, and that is distributed, you can go to Akeda, Appleseed, the health department, UH Samaritan. You can even come to the board. We are going to have a presence out at our fairs, both the Ashland County Fair as well as the Loudonville Street Fair. We will be distributing what we call Narcan keychains. So you've got a keychain with a holder that the Narcan goes into, so it can be conveniently carried, if you will, because you just don't know when you might encounter a situation where the Narcan could save a life. So look for us at both the fairs, because we'll be distributing those things. And as we get closer to those dates, I'm sure I'll do another podcast as well as some social media on that specifically. But we will be distributing it at the fair. But you can already go to Akeda, Appleseed Health Department, the hospital, UH Samaritan, and ask them for some Narcan and get that. In addition, though, to the Narcan, there's sometimes around town in public institutions like libraries and other places, things that are called Nalox boxes. And that's just a fancy term for it's like a box on the wall that is not locked. You can unlock it or open it. And inside is the Narcan with the plunger all ready to go for you in case you need that. So you may be at a building, just like you look for fire extinguishers or exit signs. You might want to be aware when you're in some of these buildings. Just look around. It's pretty easy to spot these Nalox boxes, just to be aware that if the organization or the building you're in is equipped with those. And if not, maybe ask somebody if they'd ever considered equipping their common space, their public space, with a Nalox box. Something else that we've been doing in Ashland County for several years that is really proven to be useful is something called the Quick Response Team, QRT. Now, this is made up of a staff member at Akeda. She's a peer, and she goes out with law enforcement to visit folks that have recently overdosed but have been saved, have been brought back. These are folks that usually have made their way somehow to the ER, UH Samaritan typically. And their information is passed on to law enforcement, which also coordinates with Lori at Akeda. They go out to visit the person, ideally within a few days after they've been brought back from their overdose, and talk to them about that recent experience. But again, talking to them in such a way that they're trying to make sure that they're engaged in treatment, and if not, to try to persuade and engage them to start services, because obviously they just experienced a very significant event. Without some kind of intervention, they likely would have passed away. So the thinking around quick response teams is to see that near-death experience of overdose as an opportunity to engage the person and not just leave them without any kind of outreach. So that has proven to be successful. We go out, talk to the folks, give them information, talk to the loved ones that might be there. friends and family that might be there, and just thank our law enforcement working with Akeda and Lori to do those. In addition to our quick response team, we have 2 drug drop boxes. I know you've seen some of our social posts where we highlight the drug drop-off days that occur twice per year. There's a big emphasis on getting rid of unneeded or extra old medications that might be lying around in cabinets or on countertops in medicine cabinets. Those drug drop boxes are available anytime the facilities are open. One is at the Ashland Sheriff's building, and actually was recently moved to the coroner's office lobby. And that was significant. Our new sheriff explained he wanted folks to have 24/7 access to that drop box. They basically look like a large mailbox that you take those unneeded extra medications and you just dump them in there. And there's another drug drop box down in Loudonville at the police station. That one is accessible, I believe, just during their normal working hours. But those are available throughout the year. We spotlight the drug drop boxes on those 2 days of the year, but just keep in mind they're available throughout the year. Just get rid of the unnecessary medications. This helps reduce overdoses and overdose deaths. Another incredibly important thing that we do locally in the board funds school-based prevention and education. So this is education for our young people that is tailored to the specific ages of the young people. We're teaching them, again, about trusting adults, about talking openly if they're concerned about a classmate or a friend. It's about creating a kind of communication and skills around resiliency that will help them be more and more likely to stay clean and sober, regardless of the substance. But we also address opioids. And that is going on in all the Ashland County schools. And I just, if folks don't know that, it's a big part of what the board is doing in terms of funding prevention education in our schools so that, again, over time, we reduce the number of folks that are even using substances and then might be suspect or at risk of an overdose. Last but not least on this is our community-based prevention, education, and awareness efforts. And quite frankly, this podcast is an example of what we're trying to do to spread the word that, it's an issue, but there's resources and help available. Not only do we talk about these things on the podcast, but we certainly have many posts on social media on our website. But we also, like I said, we're at the fairs. Most of our training events will have Narcan available and information available about the quick response team as well as the drug drop boxes and prevention. So lots of good things going on locally. I think all those things combined, as well as others that I'm not even aware of, have really helped us reduce our numbers and cut them in half back in 2024. And I hope that number continues to fall. Like I say, our goal is always 0 when it comes to any of these deaths. One word of caution, if you will, that there's more and more research coming out about potential brain injury to somebody who does have an overdose. Again, so the person overdoses, is brought back by Narcan. There really is a high risk of what they call brain injury, hypoxia, and anoxic brain injury. Those are the technical terms for that. And essentially what happens is anytime there is a lack of oxygen or a reduction or elimination of oxygen to the brain, if it's restricted in some way, which is kind of the definition of hypoxia, there is a real possibility that the person can suffer brain injury because of that. And as they look at emergency room data, we've seen that many revised overdose patients experience confusion, seizures, altered mental status for hours or days, and some even go on to develop long-term disabilities. Again, this is national data I'm talking about. So there's more and more research on this because we've had so many overdose deaths, but we've had even more overdoses where the person is brought back. So I say that just to maybe reinforce why the board is so interested in the prevention efforts, such that the person either never overdoses even once, but if they do, that's part of the education piece to understand that just because we have Narcan and we can bring you back, hopefully, from an overdose, doesn't mean that overdose doesn't have consequences. So I think we need to be a little bit more clear on that in the community to let folks know that, yes, Narcan is wonderful and it does save lives, but overdoses have consequences, and we want to avoid the overdose altogether. August 31st, put it on your calendar. You'll see plenty of events and other, I think, education and awareness on different media sources that August 31st is Overdose Awareness Day. We are going to extend it beyond a day. You're going to see us, like I say, at the fairs in September and October down in Loudonville, but we're going to continue to draw attention to this outside of that one day. But I think it's important to have a day. Come to our website. You'll see it on our social media where we will bring to light more of this information that I shared with you today. And until next time, please join me in keeping Ashland healthy. Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in keeping Ashland healthy.